So, Bismillah ar-Rahman ar-Rahim. Today I will speak about an important topic to continue my speech before about clinical triads and the clinical tetrads and the clinical pentads. I already finished talking about clinical triads and they're important in medical diagnosis in 5 episodes before. So my topic today will be focusing on clinical triads and the clinical pentads and the role in medical diagnosis, because these clinical tetrads and the clinical pentads help in diagnosis of certain medical disorders, diseases, and syndromes, as you will see. Let us start by talking about the clinical tetrads. The clinical tetrads are two. We have the tetralogy of Fallows or Fallow tetralogy, and the tetrads are, as I mentioned before, 4 symptoms and signs or lesions due to affection of 1 to 3 organs in the body. In this Fallot's tetralogy, the 4 tetrads are pulmonary stenosis, and this pulmonary stenosis is valvular in nature, so it is pulmonary valve stenosis together with a ventricular septal defect, right ventricular hypertrophy, and overriding aorta. Again, the tetralogy of Fallow, the 4 disorders or cardiac lesions in Fallow syndrome or tetralogy of Fallow, they are the valvular pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy, and number 4 is overriding aorta. This is in the tetralogy of Fallow, or Fallot's tetralogy as we say it in English, but we say tetralogy of Fallow because Fallow was a French physician. So it's a proper pronunciation is Fallow, so tetralogy of Fallow. And then we have the tetralogy of Meniere's disease. And the tetralogy of Meniere's disease, there are 4 symptoms and signs which point to the diagnosis of Meniere's disease. And these 4 symptoms and signs are vertigo, tinnitus, in addition to fluctuating low frequency sound hearing loss, and oral fullness, oral fullness. So vertigo, tinnitus, low frequency sound hearing loss, which is fluctuating in nature, and number 4, feeling of oral fullness. This is called the tetrad of Meniere's disease. And this disease is characterized mainly by, or presenting mainly by vertigo and tinnitus. So it should be considered in the differential diagnosis of anyone presenting with vertigo and tinnitus. But the complete 4 lesions or 4 manifestations of Meniere's disease are vertigo, tinnitus, fluctuating low frequency hearing loss, because this hearing loss is towards the low frequency sounds only, and they are detected. This is detected by the doing an audiogram to the patient to detect this characteristic low frequency hearing loss, in addition to oral fullness, as I mentioned. This is the tetrad of Meniere's disease. Now let us move to the pentads, the clinical pentads, which are helpful in diagnosis of some medical syndromes. And let us start by the number 1, the Pentalogy of Fallow, because we are talking about the tetralogy of Fallow now. I will start the pentads by talking about the Pentalogy of Fallow. This is the same as the tetralogy that is formed of pulmonary valve stenosis, ventricular septal defect, right ventricular hypertrophy, and overriding aorta, plus number 5, the presence of patent foramen ovale or an atrial septal defect, a patent foramen ovale or an atrial septal defect. When the tetralogy of Fallow is